Welcome back. In this video, we'll talk about the diagnosis and treatment of depression. Keep in mind, to make the diagnosis of depression, you have to rule out medical causes like Cushing syndrome and drug abuse. We start screening for depression by the age of 12 years old. The patient has to have 5 of the following symptoms for at least 2 weeks with functional impairment. The symptoms can be memorized with the mnemonic SIEGE-CAPS. So, sleep disturbance, interest loss, guilt, energy low, concentration loss, appetite disturbance, psychomotor agitation or retardation, and suicidality. Again, the patient has to have at least 5 of these for at least 2 weeks, and they have to be severe enough to affect his daily function. We have 2 alterations to the diagnosis: depression with psychotic features, which is having the exact symptoms that we've mentioned before, plus psychosis. But the psychosis has to be with depressive features. For example, if somebody is depressed and they're hallucinating voices telling them to harm themselves, this qualifies for the diagnosis of depression with psychotic features. But if they were depressed and they were hallucinating about aliens or the CIA, this would not qualify for the diagnosis of depression with psychotic features, as the psychosis is unrelated to depression. We also have dysthymia, which is also known as chronic unhappiness. It's defined as the presence of at least 3 symptoms of the ones that we mentioned for 2 years or more. Depressive patients also have changes in their brain. For one, they have decreased REM latency, which means that they reach REM sleep faster. They also have shorter intervals in between REM sleeps, so they have more REM sleeps in total. This, of course, disrupts the normal sleep pattern and decreases the delta waves or the slow waves, which is where the restful sleep occurs. They also have morning depression, which is thought to be the cause of cortisol surge that occurs in the morning. And perhaps that's also the cause of depression and Cushing syndrome. For management, the first-line therapy is, as always, SSRIs. Then we have SNRIs, and if both failed to alleviate the symptoms of depression, there are so many medications to try as third line. The treatment should continue for at least 6 months after the symptoms resolve. If a patient has 2 or more prior depressive episodes, or depressive episode with suicidality, or dysthymia, the treatment can take years or be lifelong. And finally, the treatment of depression with psychotic features is SSRIs and antipsychotics like olanzapine. And here's a small quiz for you. Which of the following medications can cause depression? And the answer is interferon. Alright guys, that's all I have, and thank you so much for watching.